Hello, Namaste. I'm Dr. Sushil Adhikari, and in this video, I'm going to talk about normal breast anatomy and some common breast pathologies that we see in ultrasound. Breast lies on anterior chest wall above thick muscle called pectoral muscle. Going from superficial to deep, breast is covered externally by skin and subcutaneous fat. Below skin and subcutaneous fat, you can see glandular tissue of breast. You should be able to clearly identify normal glandular breast tissue in ultrasound because sometimes skin and subcutaneous tissue pathology can be misdiagnosed as breast pathology. This is the ultrasonographic image showing normal breast going from superficial to deep. This outermost layer is skin. Deep to skin, this hypoechoic area is subcutaneous fat. As fat appears hypoechoic in ultrasound. Deep to subcutaneous fat, this somewhat hyperechoic area represents normal glandular breast tissue. Size of the glandular tissue can vary significantly with age and gestational status. Deep to the glandular tissue layer, this small area represents retromammary zone. Retromammary zone is mainly composed of fat, blood vessels, and lymph nodes. This deep layer here is muscular layer. Breast lies above the pectoral muscle. So this layer represented by linear long hypoechoic band is pectoral muscle. Deep to pectoral muscle, this hyperechoic structure is rib. Rib being bony structure, it prevents deeper penetration of sound beam. We can see posterior acoustic shadowing deeper to the bony rib. Two ribs are joined by another muscle layer called intercostal muscle. Sometimes, normal rib can be confused with focal lesion of the breast like fibroadenoma. However, you can see strong posterior acoustic shadowing behind the normal rib. If you closely look at the normal rib, you can see relatively hypoechoic intercostal muscle on either side of normal rib. Visualization of multiple ribs at the same skin level can be another clue to correctly separate normal rib from breast pathology. In the medial aspect of anterior chest wall, you can see cartilage, which appears as a hypoechoic oval structure. Similar to rib, cartilage in parasternal region are also connected to each other by intercostal muscles. Mammary zone is where most of the ducts and lobules of the breast that give rise the breast pathology actually lies. Mammary zone is enveloped in thick and tough fascia. Anteriorly, anterior mammary fascia separating breast from subcutaneous fatty layer, and posterior mammary fascia separating the breast from retromammary fat. Cooper's ligament connects anterior mammary fascia of the breast to superficial fascia, and it appears as a curved echogenic structure in anterior aspect of glandular breast tissue. Here is a case of 16-year-old female came with breast pain and lump in upper outer quadrant of breast. On ultrasound, you see this type of the image. So what could be the possible diagnosis? Here in this image, you can see a focal prominence of the breast tissue giving an external appearance of breast lump. Breast tissue is not equally distributed in all quadrants. Usually it is more pronounced in upper outer quadrant. Prominent breast tissue can undergo hormonal changes during menstruation, leading to occasional breast pain and breast lump. Common pathology of the breast are breast cysts, fibroadenoma, breast cancer, and palpable glandular breast tissue. Look at this image. This is the normal breast ultrasound with central echogenic normal breast tissue. On the other hand, you can see well-defined round anechoic cystic lesion within the fibroglandular tissue of the breast. If you closely look at the posterior aspect of this cystic lesion, you can see posterior acoustic enhancement. Margin of this lesion is well defined, and on both sides of this cystic lesion, you can see few similar cysts with same characteristics. So these are multiple simple breast cysts. Once you see one breast cyst at particular location of the breast, you have to look for other breast cysts as multiple breast cysts are quite common. Here are a few more examples of simple breast cysts. Sometimes multiple simple breast cysts join with each other, forming clustered microcysts. To summarize, simple breast cysts are well-defined, anechoic, round cystic lesions with sharp margins and posterior acoustic enhancement. Simple breast cysts are definitely benign type of the lesion, and hence no follow-ups are needed. They are categorized as BIRADS 2. Now look at these images. On right hand side, you can see a well-defined cystic lesion with posterior acoustic enhancement. But if you closely look into the lumen of this cyst, you can see an echogenic content resembling tiny calcification in the dependent part of the cyst. If you change the position of the patient and rescan after a few minutes, these calcified structures again resettle in another dependent location. This cyst fulfills all the requirements of the simple cyst except this macrocalcification. So, mobile macrocalcification within a simple cyst is called milk of calcium, and it is a feature of benign lesion. So, these are also categorized as BIRADS 2 lesion. Now, look at this image. You can see multiple intercystic mobile calculi within the simple cyst. Again, mobile calculi within simple cyst are benign and categorized as BIRADS 2. Now look at this image. On right hand side, you can see a well-defined anechoic cystic lesion with posterior acoustic enhancement. On the anterior aspect of this simple cyst, you can see echogenic content. So this echogenic content in non-dependent part is fat fluid level. If you move the patient, this content again resettle into another non-dependent location after a few minutes. Fat fluid level within simple cyst in lactating woman indicates galactocele. Galactocele is milk retention cyst due to obstruction of the lactiferous ducts. Diagnosis is supported by typical history and location of the lesion, as galactocele occurs in young lactating woman at subareolar location. If you still find it suspicious, then percutaneous aspiration is suggested. You will find milky fluid with various proportions of protein, fat, and lactose. Thank you for watching this video till the end. Remaining part of the breast ultrasound will be covered in next video. Please stay tuned.